My experience is coming from a transplant and cell therapy background and thinking about, immunology and dynamics of treating patients with cellular therapies, and working now in this project closely together with those who are thinking from the tumor biology perspective. I think to advance treatments forward for patients, especially with refractory solid tumors, it's really going to take people looking at it from a full 360 view. So the lessons that we're learning in the transplant cell therapy space, we're hoping can translate to help move projects like this one forward. So that the other active work we have, so looking at our patients receiving bone marrow transplant for hematologic malignancies, and particularly second transplant. I think of transplant as the original immune therapy and really a basis for a lot of what we're doing now with engineered cellular therapies. And we know that outcomes for patients who relapse after they've already received an allogeneic bone transplant are very poor. But there's a small subset of patients that we can get into remission again and potentially have a long-term curative outcome after a second transplant. And really what we learned through this work that was presented at TCT was that really the biology of the tumor, those factors are most important in predicting response. So patients who we were able to get back into remission before they came to a second transplant were the ones that were most likely to have long-term survival outcomes. So that really ties into what we're doing with CAR-T cell therapy. So even if transplant is potentially curative, we need to think about the therapies available to get patients back into remission and then really get to a consolidative transplant if needed. And then our work in the extramedullary CAR-T cell sites for CD19 CAR really goes to those factors we were talking about when treating solid tumors. Right, so when CAR-T cells are going to hematologic malignancies like leukemia that are in the bloodstream, we're giving CAR-T cells right to the spot where we need them to be. And we know for patients who have leukemia that's also in other areas, like in the spinal fluid or other soft tissue masses or other organ infiltration, the CAR-T cells can get there. And we've seen in our cohort an example of some patients where we do have response at those sites. But that response is tempered compared to what we see in the bone marrow. So it's really reflecting what we see as we work into the solid tumor space. So we're really kind of coupling what we're learning about biology there, how we can couple with other therapies like radiation therapy potentially to translate those lessons into solid tumor CAR-T cells.